Hi, everyone, and welcome to the very first episode of Sculpt Center Implants and Periodontist podcast. I'm Victoria. Nice to meet you. And today I'm sitting down with one of the best periodontists I know. It's Dr. Fadi Hasan. You've seen perfect smiles, right? But now let's talk about what's really behind them. Can you tell us a little about what do you do as a periodontist?
So as a periodontalist, for me, I think what we do our goal is a cheat saving with the like to call it. That's what periodontists really is main focus on. I think in today's world, can be more driven towards teeth and implants, and now more heavily towards implants. I think the way at least I see our profession heavily is in the periodontics or the repair shop. I feel like I was going through most of the time. All the cases I watch in, there's always more complications arising from implants that are placed or certain periodontal procedures that were done. And our goal is to, kind of help our patients and see what we can do in our best ability to really fix the situation. A little bit of that.
Sounds good. I love it. Okay. The second question is, what are some of the most common procedures you perform and why they are important?
The most common procedures that I feel like we're doing here, I'll be honest with you, it's mostly gum grafting. I think that's our bread and butter. Why is it important? Whether it's teeth or implants, I feel like we're doing a lot of both of them recently, more towards implants as well. Why are they important? For me, like teeth, the way I see it is gums are like our skin. Our skin protects our internal organs from any trauma or from any bacteria, anything getting in. I feel like gums are behave the same way, the way I see it. So we have thick gum tissue, good quality gum tissue. That what it does, it's going to protect our teeth, underlying bone, which is our jawbone, and hopefully give those teeth and our jawbone a longer fighting chance. So the cases that we get to see are really more advanced situations of gum recession, previous failed gum grafting, and now we're seeing more and more of implants, especially anterior cases that are there's recession on those implants, and our goal is to really make the gums thicker, stronger, and reestablish it back to where they should be on those implants, especially the anterior cases, I would say. And trying to fix that. So I feel like that's what we're doing a lot more at least in today as well.
Yeah, that's it. Okay, this third question is, what's one thing patients usually misunderstanding about your work?
I think a lot of the confusion is they really don't know what a periodontist is. I feel like they come here as like, I don't know why I'm here, or my dentist am here, and I don't know what's going on. Then you sit down with them, you take your time, you listen to them, and then you see what's really going on. Then you have an opportunity to educate them about their overall oral health, their periodontal health. So hopefully by the time they leave, I switch up that and this understanding of what we do, of why the area that goes away.
Okay. And the next question is, how do you help people feel less nervous before the surgery?
The way we do is, honestly, it starts with a consultation to make them feel really comfortable. The question is, when our patients come here, no one wants to see a periodontist or a surgeon demonstrating. They are already nervous, afraid. There's some of them have severe maybe dental anxiety that had not the best experience in the past. And my goal is to really, again, you have to listen, make them comfortable, understand what they're going through. By doing that, and again, with condemning areas that really make them feel as comfortable as possible. The nice thing is we get to offer sedation. So if they really have dental anxiety, we can sedate them, put them to sleep, and that makes them a bit more comfortable. So we're going to the next step. We provide them those services, and that makes them, more prone to the police tonight. I'm ready to get the procedure. I want to get this space. I'll get this taken care of. So that's our goals that, they need to explain towards, I think it's our role as a healthcare provider, explain to them very, in a calm way that what's going on, what we can do to help them, and build that level of trust with our patients. So that way, by the time they leave, they are very well educated about what's really going on. And that hopefully should alleviate all the anxiety and fear, by the time they leave.
I already believe you. Okay, tell us about one of your most memorable cases.
Oh, there's a lot of them. Because we do so many different types of procedures, I think each and every one of them has its unique, I would say, characteristic of me that's basically to put it to make it memorable. I think it's usually the ones that require a lot of rehabilitation. I have one specific patient that, is 80 years old, and it took us about almost 18 months until able to finish his case. Anterior aesthetics, failed implants, and the amount of, time, commitment, trust that he had in us, and where he started, when we ended up with, I think by the end of it, he was very appreciative, very thankful, and very appreciated as well. But again, just what's so beautiful at the end of it. But again, took us time. He was very patient. That's the beautiful thing, is that when you have patients really trust you so well that they're willing to take that journey with you, it makes every same worse than I admit. So you just want to appreciate.
It's a long time. What? 18 months. That's crazy. Okay, let's go to another question. And if someone is afraid of pain of surgery, what would you tell them?
Honestly, a lot of the procedures that we tend to do today are not as painful as people or patients might think they are. Meaning that it all depends on how you do the procedure, the cleanliness of the procedure itself. If you just do it quick, if you do it like rough in a way, yes, there's going to be more complications, more trauma to the area. If you do it in a very delicate, like surgical way, which is what we love to do, post-operative is healing. And I explain to all my patients, like, you'll have some discomfort, but as far as pain-wise, very rarely do they call, I need a painkiller. Once in a blue moon, that like most of them, they leave with Advil, ibuprofen, and Tylenol. And then, we see that at 2 weeks. How was it? It's like, a little bit of swelling, but nothing too bad that it can manage with ibuprofen and Tylenol. Again, once in a blue moon, that we tend to see those cases where, yes, like just so much going on. It's a very big procedure. I know there's going to be more discomfort. So let's give them something a little bit stronger. But again, it's maybe once a month or once every 2 months on microscope, something strong, maybe even once every 3 months. So is there a lot of pain? Not really, no. I don't care what the procedure is, whether it's a sinus lift, whether it's a gum graft or an extraction or an implant, or even a full arch case, like all absorbing a lot, all next. Motion and Tylenol does the trick for 99%.
Okay, if you were an periodontist, what would you be? A rock star, chef, or a motivational speaker?
A pilot.
We're the pilot.
I love space. I love being here. And that's all I think.
That's where I try. So
Best part. But no, seriously, if I ever had been, if I was not what I would be doing, I love the idea that as human beings, we're actually being able to, be up in the air or get to space. I mean, yeah, I'd love to go to space.
So basically, feel yourself like a bird.
Feel free, yeah. Free like a bird, just being there and feel that rush and the adrenaline. Oh,
I love it.
No one knows this, but that's what I mean. My real like.
That's so cool. I mean, I think I love it too. but within other products, it's pretty high growth.